All right. Hi, everyone, and welcome to our debate on Tele-ABA versus in-home therapy. For our presentation today, we have decided to do an informal debate format. Our debate members and the roles are Heather will be the summarizer for Tele-ABA, Adrian will be the summarizer and illustrator for in-home, Hillary will be the researcher for in-home and a fielder, Danielle will be the researcher for Tele-ABA and our second fielder, and I will be the illustrator for Tele-ABA. As technology and the field of ABA advances and develops, it is critical to examine the effects of bringing new technology into treatment. In-home ABA therapy is very familiar to most of us, where experienced professionals perform ABA services in a client's home setting. This allows qualified professionals to assist in the management of severe behaviors and build rapport with all individuals involved in the case, and to create effective plans and strategies. Tele-ABA services are not as commonly known, but they incorporate telecommunication technologies and electronic information to provide services from a distance where it may not otherwise be available. These services can include training, functional analysis, and consultation, as well as support for the families. Many individuals with disabilities benefit from ABA services. However, geographical and numerous other limitations make it difficult for them to receive these services, particularly in rural communities. So let's start off with Heather.
So I'll begin the teletherapy side by talking about the benefits of teletherapy. Traditionally, ABA services are provided where therapists directly interact with the clients. We all agree that it's a very effective way of practicing ABA. However, it does have some limitations such as time commitment and cost. Teletherapy utilizes the same ABA principles, but the service is delivered virtually using videos and online communication methods. It's especially useful for clients who live in secluded areas. I found a news article from BCBA website from 2012 that had relevant visual, which I want to share with the group. As you could see, it shows the number of BCBAs per 100,000 residents across the nation, and there are less than one BCBA in some states like Oregon and New Mexico. For the states that have less BCBAs than needed, implementing a system of teletherapy can be very beneficial. Teletherapy encourages parents to actively engage in treatment of their children. It allows families to be in control of time and nature of their session. They don't have to worry about different people coming and going, unintentionally invading their privacy. They can provide ABA on their term in their most comfortable environment. It also promotes generalization, eliminating the difficulty or sometimes even failure to transfer instructional control from the therapist to the caregiver. I've heard from so many parents saying some behaviors only happen on the weekends or during the nighttime when the therapist is not there. Teletherapy allows parents to work on behavior management in the environment that the behavior actually occurs with the individual who is typically there to manage the behavior. So from the beginning, it gives parents the tools to use when their children engage in problem behaviors. Now, not every parent feels competent to learn ABA because there are so many little components that make a single intervention plan. Without an ABA therapist present in the room providing direct support for the family, they might feel overwhelmed. And as it is with in-home therapy, it's very important to provide ongoing parent training and consultation when using teletherapy. I found a research article by Vismara, Young, and Roger, who conducted a study about effectiveness of teletherapy in training parents. They provided 9 parents with DVDs of learning modules and held 12 online live conferences where BCBA observed the parent-child interaction and provided feedback when needed. And after 12 weeks, parents became more fluent in contriving learning opportunities and utilizing ABA principles to teach new skills in functional manner. They also became much more sensitive to their child's needs and chose more appropriate methods to manage behavior. So overall, parents reported that teletherapy helped them to understand ABA without having the physical presence of a BCBA. Teletherapy also lowers the cost of transportation because clients and therapists don't have to drive to designated locations for sessions. The decrease in drive time increases the availability of providing more sessions as well, which allows BCBAs to reach out to more clients. Lastly, teletherapy also is a great alternative for clients who are medically fragile or allergic. I currently work with a 4-year-old boy who is allergic to vast variety of food item and often goes to the ER to treat the severe allergic reactions that he has on a daily basis. It is so severe that the therapist try not to eat anything before their session. So teletherapy limits exposure to potentially harmful stimuli, but continue to provide a quality ABA service. So now Adrian will talk about the benefits of in-home ABA therapy.
Adrian, your mic is muted.
Thank you for telling me. I've just been talking to myself. Okay, so hi, thank you, Heather. My name is Adrian, and I am the summarizer for in-home services and supported community living services. According to Weiss and Del Molino, there are two forms of in-home services that are used most often. The first is the basic model. The basic model is in-home services is supervised by a BCBA who is responsible for hiring the therapists. The therapists are responsible for managing data and implementing interventions. The second model is more of an alternative model, and the alternative model is much more parent-centered. The parents are responsible for hiring staff, managing data, and they have a much more significant say in the programming with the help of a BCBA. In a study completed by Smith, Buck, and Gamby in 2000, the alternative model showed high rates of parent satisfaction. However, the therapists had less procedural integrity than those in a clinical setting. ABA intervention involves a qualified and trained behavior analyst who oversees the programming, as well as detailed assessments that are used to develop treatment goals. The treatment goals are designed to increase the independence in both the long and short-term goals of the client. The instruction plan is to break down skills into manageable steps for the individual, and then gradually combine the steps until a complete task is taught. All of the data is frequently reviewed and analyzed in order to measure the progress of the learner. If the learner is not showing progress, the intervention is adjusted to meet the needs of the individual. Additionally, the analyst will meet regularly with the family and staff in order to review progress and discuss future goals. In-home ABA therapy allows the individual to interact naturally within their environment, therefore allowing the behavioral therapist to address interfering behaviors as they're happening. Furthermore, programs can be designed to take into account the family dynamic, everyday triggers, and the individual's daily framework. Many times, interfering behaviors occur during scheduled routine-based activities, such as dressing, bathing, sleeping and waking up, mealtime, and bedtime. If the behavioral therapist can intervene while the problematic behavior is taking place, the challenging behaviors are likely to decrease. In-home services cover a wide array of services. These services are all dependent on the needs of the client and include such things as self-help, behavior modification, communication and social development, functional living skills, collaboration with schools, employment and vocational skills, positive peer interactions, academics, fine motor and gross motor skills, and play and leisure skills, amongst many others. These skills are taught through pairing and play, discrete trial training, pivotal response training, natural environment training, and verbal behavior training. The progress made depends on each individual client. Some learners acquire skills quicker than others. Typically, however, 1 or 2 skills are acquired rapidly, while additional instruction and practice are required to acquire other skills. The number of direct one-to-one intervention hours is dependent on the individual and can range from 1 hour per week to over 40 hours a week. Funding for these services comes from supplementary security income, Social Security, disability insurance, Medicaid waivers, and private pay, amongst others. And now I will pass it on to Hillary for the researcher for in-home.
Hey everybody. A study conducted by Reed, Osborne, and Cornish in 2007 compared high-intensity in-home therapy services and low-intensity in-home therapy services for individuals with autism. High-intensity services was defined by 20 to 40 hours per week, and low-intensity services was defined as 10 to 20 hours per week. All individuals who participated in the study benefited from receiving ABA services in their in-home setting. However, the individuals who received the higher intensity services, which was the 20 to 40 hours per week, did make more gains in their IQ and their functioning and showed less signs of autism symptoms than those who received the low intensity services. Mary Jane Weiss and Laura Domino conducted a study in 2006 with preschoolers who received intensive ABA services in their home. These children also made significant gains in their IQ, and their symptoms of autism also decreased. The results of both of these studies show that in-home ABA therapy services is an effective service for individuals on the autism spectrum. Both studies included mass trial of teaching with short breaks and discrete trial training, as well as natural environment training. Research has also shown that overall parents have had positive experiences and attitudes by receiving in-home therapy ABA services, and Adrian will go more in depth with this shortly. Because a provider of the in-home therapy is a BCBA or a highly trained staff, there is less pressure on parents to learn all the procedures of their child's programming. This is a benefit of in-home ABA therapy because it is much less stressful for parents and their role of implementation of programming, which is less dramatic than compared of Tele-ABA. Within Tele-ABA, it has been reported that not all parents feel confident to implement programming while teleconferencing with a BCBA. Within in-home therapy services, there's also no need to worry about technical issues as there is with Tele-ABA. All materials for programming should be in the individual's served home. Technical issues and internet connections may prohibit or hinder accurately implementing sessions when sessions are completed over teleconferencing. This is not an issue with in-home therapy services, as the staff comes to the individual's home and conducts their programming. In-home therapy also gives parents the opportunity to build trust with their BCBA and their staff, as they have an opportunity for that face-to-face interaction and the open communication. And they have more time to get to know the BCBA and the staff as well. In-home therapy stays within compliance of HIPAA because all contact that is made is in person. All documents are passed from hand to hand from the BCBA or their staff to the parent or guardian. It is then the parent's responsibility to keep all the paperwork safe in their place of choice. Treatment integrity can easily be checked through self-reports by the BCBA and or their staff, or the BCBA has the opportunity to go observe staff while they're working with the individuals served and give them feedback on their performance. Generalization is also easily worked on because sessions are run in the individual's natural environment. Also, if permitted by the parents, staff can actually take their child served out into the community to work on mastered skills in a variety of settings, which also helps out with generalization. Most of the time, there are also multiple staff assigned to one individual, so there is an opportunity for the individual to follow instruction and complete tasks across multiple people and staff. Adrian will now go more in depth of the benefits of in-home ABA and parents' reported views on in-home ABA services.
Okay, so Grindle, Koshov, Hastings, and Remington completed a semi-structured interview format to determine how early intensive behavioral interventions in the home affect the families. In general, parents and siblings of the individuals receiving services were positive about the effects of EIBI in their lives. The chart here denotes that parents were pleased with the development of language and communication skills, social skills, and play skills. Additionally, the parents benefited from more support in the home, as well as more free time for socialization opportunities, and as well as more opportunities to learn and use ABA therapy techniques. Now I will pass it on to Danielle, the researcher for teletherapy.
Hi, so I'd like to first talk to some of the points that Hillary made about Tele-ABA in comparison to in-home and incorporate some relevant studies to these points. So one thing she mentioned was that parents are not always comfortable with participating in it, and one study I'd like to examine is a study done by Vismara in 2013, which incorporated 8 families to test their ability to properly deliver Tele-ABA services to their child over a 12-week program, and then intervention results as well as parent satisfaction were measured. The parents' fidelity increased from incorrect implementation before training to correct implementation, and all children made progress, as well as all families felt supported and satisfied with their telehealth training and experience. Some of the limitations to that, though, were that there was only 8 families, and they also reported that some families needed more support than others, but the overall findings are positive for this point. Another point I'd like to talk to is that Hillary mentioned in-home ABA is HIPAA compliant and therefore can keep clients' records and information confidential. Luckily, for the field of Tele-ABA, there is HIPAA-compliant video servers such as Zoom that ensure this same promise. And while some may say it's easier to keep information confidential in person, I would personally argue that Tele-ABA is easier to keep confidential because the BCBA on the other line must already be in a secluded place to start with, such as their own private office, and they really don't require collaborating with others as much because there's not ABA therapists in the home. So that removes the HIPAA compliance threat of discussing patients in public with other individuals. Documentation can also be passed through HIPAA compliant servers such as Dropbox, eliminating the need for paper copies of documents and the threat of violating HIPAA violations when you keep the paper copies. While Hillary also spoke to the effectiveness associated with in-home programs, I'd like to discuss a few articles that confirm Tele-ABA can also be an effective treatment method. The first article I'd like to start with is Wacker from 2013, and they looked at whether functional analyses could successfully be conducted through teletherapy with 20 participants 29 to 80 months old. The results showed that functions were identified accurately as maintaining the behavior in 18 of the 20 cases, and that IOA was over 90%. The same article also depicted an important factor when comparing in-home and Tele-ABA, which is cost differences. This article talked about telehealth functional analyses costing on average of $57 per week, whereas the services being provided in-home would have costed closer to $300 per week. Proving the cost effectiveness of services provided via telehealth and the ability to reach more families both geographically as well as financially. The last 3 articles I'm going to mention show that providing functional communication training, discrete child training, and pivotal response training can also be successful in telehealth ABA. So Wacker did another article after the functional analysis was successful on functional communication training, which was taught via telehealth to the families to implement with their children. Challenging behaviors were reduced by 93% on average, proving the success of FCT training through telehealth platform. The limitations were that the results were given per function, and the function for attention, there was only one, I'm sorry, one student who had the function of attention, so the results were less generalizable for that rather than like the tangible function, which had 13 participants. Another article was by Lafasakis in 2007, which included 3 parents who were taught to implement discrete child training for gross motor imitation, and then they looked to see how well the parents could generalize their knowledge to teach vocal imitation in the same way. The children's correct responses for both programs increased, proving the effectiveness of teaching parents DTT, their ability to successfully implement it with their children, and their ability to generalize it. The limitation was that there were very few participants, making it not as generalizable, but participants were required to be able to imitate vocalizations already, which makes it not as generalizable to individuals without that skill. And Genghis in 2015 included 23 families who were taught to implement pivotal response treatment for their children through a 12-week parent group intervention through Tele-ABA to measure the changes of language and cognitive skills. A 3-month follow-up was also done to evaluate the maintenance of the skills learned. And the results of this showed that all children increased language and cognitive skills and maintained those skills when assessed 3 months later. The limitations were that parent fidelity did show to drop after the skills were mastered, but the success of the children didn't seem to be affected. And then something to boost that would be to incorporate more, like another parent training after after they were already mastered, just to keep, just to keep the programs running just as smoothly and keep the fidelity high. Overall, the studies represent a small number of individuals, so many more studies do need to be conducted to help control for variables and ensure the effectiveness of this method. What it does give us is a great starting point for further studies and an idea of the effectiveness it can have on children if implemented correctly. Next, Chelsea will illustrate the costs of providing care in home versus through Tele-ABA.
All right, so just to build off of what you just said about cost effectiveness, I have a table. A major benefit of Tele-ABA is its cost effectiveness. According to Wacker et al., ABA services delivered via telehealth have saved clients significant costs due to the reduction of travel and consultant time. Travel costs can be a huge expense on both the professionals working and clients. In rural areas, it is very common for clients to live in a 100-mile range from the behavioral consultant. Providing services via telehealth will save hours worth of driving time as well as travel expenses, and the savings are shown in the overall cost of teleservices. Additionally, the lack of access to service providers has resulted in many individuals going entirely without the necessary services. Here is a table that breaks down the cost of the in-home ABA services versus Tele-ABA services. As we know, the expense of therapy can be a huge issue for parents and caregivers and often results in limited services or the inability to obtain any services at all. Here you can see that services via telehealth cost $60 per child per week compared to services in person, which can cost $291 per child per week. This is a drastic difference, and over 6 months of services, it is a difference of about $5,500. There are many families who aren't getting the cost covered through funding services, and the results can either be long delays in receiving services, the family taking on a financial load, or ultimately going without the service completely. Tele-ABA allows practical and quality services to be delivered without such a heavy financial burden. Oops. All right, so Danielle, I think it's your turn now.
So to conclude, we're going to wrap up our thoughts in response to some common questions. So one of the main questions is, which is better? So given our discussions, we all agree that while Tele-ABA has some convincing studies to back its effectiveness, it's still really new and requires more studies to be done. We agree that Tele-ABA is more beneficial than no ABA, but should really only be targeted when the family is out of range of a local BCBA to provide programs, rather than replacing in-home therapy where it is available at that time. Another question would be what future research would be beneficial. So studies done directly comparing families receiving in-home and telehealth ABA services would really help gain a better understanding of the exact degree of comparable effectiveness. Most ones that we see are effectiveness with one or the other, and they don't compare the two. Overall studies for Tele-ABA that look at wider age ranges, include more participants, and testing fidelity and IOA would provide a more stable result pool to draw conclusions from. So next, Hillary will continue with some more questions.
Another question that might often be asked is if in-home ABA will one day be replaced by Tele-ABA. As more studies are conducted and more data either confirms or denies the effectiveness of Tele-ABA, then further statements can be made on whether or not it can be equally beneficial as in-home therapy and can be replaced by it. At this time, there's not many studies on the topic for reliable comments to be made. But as you can tell, more individuals are being diagnosed with autism spectrum disorder every day. And as you saw from our map, there are not many BCBAs out there. So it is possible that Tele-ABA will become a lot more popular to provide those services for individuals who are out of reach of a BCBA. And then another question that is often asked is, how do the BACB professional and ethical compliance codes and HIPAA affect telehealth or Tele-ABA? And to answer that, in order to be in accordance with HIPAA rules, as Danielle previously stated, professionals must ensure that they are using HIPAA-compliant platforms such as GoToMeetings to hold the video conference to guarantee that the client's information stays protected. Professionals also need to make sure that they are holding the conference in a space that nobody else is around, that they're not conducting the conference in a public space or in a space that is at home where others could overhear what they're talking about with the clients. As for ethical codes, some codes are easier to abide by for Tele-ABA, such as the code 1.06, multiple relationships, because when you are video conferencing over your sessions, you are not as likely to get to know the family as well, where you might be invited to birthday parties or where staff are thinking that, or parents are wanting staff to babysit their child, so they're not as easily likely to develop those multiple relationships as they are in the in-home. Another code that is easier to abide by Tele-ABA is code 2.06, which is maintaining confidentiality, because like Danielle previously stated, there's not a whole team that's often working with the individual. It's often one BCBA who is working with the parent, so there's a lot less likely for the all staff who are working with the individual to be talking about the individual served outside the therapy home or in a public setting. So for now, that is the conclusion of our debate. If there is any other questions.
Okay, so I think your group did a really nice job of presenting. It was very well organized, and I think you did a really good job presenting the two different sides of, you know, thinking about Tele-ABA versus in-home ABA, and you think you did a nice overview of both of those and some of the positives of each and some of the concerns associated with each of them. And so one of the things that you discussed was natural environment training, and that was one of the points that was made in regards to supporting the in-home therapy. And I was just wondering if there was any research or if you have any personal experiences about how Tele-ABA could be used to help our clients get out into more community settings and help them work on those social validity and importance of being out in the community. And I was just wondering if you have any personal experiences with that, or if there was any research that addressed that, or if you have any thoughts in regards to what the ethical concerns might be with that.
So I don't have personal experience with it, but I would say that it's harder to do that through Tele-ABA, because really for the BCBA to give good advice, the parent would have to like walk around with the camera to kind of see what the interactions would be, or it would be harder for them to give good advice on what to do because they can't be there. So in that sense, I do think that in-home would definitely be more beneficial. And the natural environment teaching, though, in general, I do think that that is something that the parents can be taught by the BCBA. I did not find any specific studies that only looked at that, though. So I think that would be a good place to do some further research on that end.
Okay, terrific. And so one of my other questions was, and you kind of touched on this a little bit, but I don't know if you found anything specifically addressing, like, and you mentioned some of the technology, but you know, I was thinking, as we know that there's more technology being developed, does it seem like do you have a feel for how significantly Tele-ABA is increasing in the field? Do you feel like this is something that people are moving towards based on the research that you found for this debate?
So based on what I found, I'm not really sure if I think it's gaining publicity, kind of. People are talking about it more just for areas that don't have BCBAs. And I think it also applies to people that are looking for supervisors, people that are looking for BCBAs to supervise, I think that has been a lot more talked about to get supervised remotely. So I think that is definitely gaining popularity. And honestly, I hadn't heard a whole lot about this beforehand, and looking more into it, it does seem like people are trying to also make Tele-ABA gain that same kind of popularity, and showing that it can also be effective for the families that can't find BCBAs locally.
Okay,
Sorry. I was just going to add on that. This is on a personal note. The clinic that I work in, I currently live in Iowa, whereas you saw that we are definitely lacking in BCBAs. And it has become a much more popular thing that we have been experiencing, and we've had a lot more parents interested in telehealth. And we have started developing it within our clinics, our early intervention service, because in Iowa there's a lot of rural areas where people can be up to 45 minutes away from a large town with our intensive ABA services. So here it has become much more popular for parents to be interested in wanting that service.
Just to piggyback on that, I live in Iowa as well. And the clinic where I work, I actually have a virtual parent training child on my caseload. So we have services 3 times a week for about an hour and a half. We use a Nest Cam, and we talk to mom through a earpiece, and it's actually a really fascinating. We get to actually review every single procedure that we would do in the clinic, and mom is she's become basically an ABA therapist. It's amazing. She knows all the terminology. And she is able to use a lot of the interventions, and we continue to teach those. And the nice piece of it is that we can review procedures about, or that have to do with going out into the community more. And because she's already been taught how to run procedures at home, she can just easily generalize it to the community. So that's my personal note.
I also want to share that I recently talked to my supervisor who attended the Tele-ABA, the ABA conference in California. She told me that a lot of BCBAs are more aware of teletherapy, whereas before it wasn't even an option. So if the child was sick or they couldn't afford to have services anymore, they would just cancel or just delay services. Whereas now, at least they're aware that there's an alternative to provide services. We don't necessarily have to be in the home or in the community with them. So it's definitely, I feel like they're becoming a lot more aware, and in this, they're going to conduct more studies to make it more valid points and make teletherapy more reliable for clients.
Okay, terrific. Go ahead.
Yeah, so before this, I really didn't even know it was called Tele-ABA. And one of the clients that I have, we do some supervision via iPad, via FaceTime. So we actually use it at my clinic, and I didn't really realize that was what it was called. So yeah, I definitely think that it's becoming more popular and widespread.
I'm from Chicago, so I didn't have any of that experience. There's people everywhere providing services, so we don't use it here.
Yeah, and I was curious too. Was that map that you showed at the beginning about the numbers of BCBAs in areas? Did you say it was 2012 or 2010?
Yes, 2012.
2012. Okay, yeah. Because I'm just wondering now. We know that BCBA is continuing to grow, and that there's more and more people pursuing it. So I was curious when you showed that map how different it might be now in 2016, even just 4 years later, because I know it's kind of exponentially increased. But I think, like you mentioned, there's still definitely rural areas that don't have any access to BCBAs, and so I think Tele-ABA could be a really interesting way to address that for those clients. And so my last question was, I was just curious if you have any personal experiences, or if you found any research. I know you mentioned a little bit about parent preference and how they felt about ABA, but I was wondering if you had any specific experience or research that you found in regards to examining the client's preference. Do you think that they have a preference in regards to doing it via Tele-ABA or in-home?
I actually had a client last summer who decided that they're going to travel for a month. And it was very essential that we provided all 40 hours of intense ABA for him because he was in such need of everything really. And we decided that, okay, it's fine if you want to travel, but we would really like to continue the ABA services. So we ended up Skyping, and she definitely preferred in-home because she was more confident that we were doing our job rather than just providing feedback via Skype. But overall, she enjoyed it, and she was appreciative of being able to continue ABA services, even if it was just 10-15 minutes a day, just to get that consistency going and keep the service, I guess, continuous. So she preferred in-home, but she liked the idea of teletherapy as well.
So for her, it was okay. It was better. It was to have something was better than nothing, based on her preference.
Yeah.
Okay.
I didn't find any specific studies on whether the kids would prefer in-home or tele-ABA. That's what you're asking, right?
Mm-hmm.
More of the kids. So I think I didn't find anything specifically to that, but just thinking about it, I would almost feel like there would probably be a lot of complications doing it tele-ABA only because they have relationship with their mom or their dad already. So when their mom and dad start putting more of these structured instructions in place, I think it might be difficult for the child to be able to accept that. Like, hey, my mom is making me do all these like really hard things when usually we're playing around and doing this. So an in-home ABA, when a therapist comes in and can play, but then also put those instructions in place, I think from the beginning that's what they know and that's what they're used to. So it actually might be more difficult for the child to adjust to a parent who's now trying to like switch roles or play multiple roles.
I definitely agree with Danielle where I think it would be harder for the parents to switch roles like that. I was a program coordinator for in-home services for over a year, and all the children that I worked with or had staff working with all had very positive experiences with their in-home therapy. Oftentimes children were really excited to see their therapist coming and missed out or were bummed out when their therapist couldn't come or schedule changes. So overall, I've had very positive experiences for in-home therapy with children and with the parents.
Okay, so my final question is, I just was wondering if anybody else has anything else that they'd like to share regarding this topic that might be relevant. No? Okay, all right, well, that's fine. Your group did a really good job answering the questions. We could go ahead and end the recording there.